Barriers to short breaks. Experiences of parent carers and disabled children and young people in Gloucestershire. What we did. Introduction. In 2022, Barnwood Trust conducted research about the experiences of parent carers and disabled children and young people in accessing short breaks and respite care in Gloucestershire. In addition, the Trust spoke to several providers of these services to contextualise what families were telling us. This executive summary contains the key findings from the research. If you would like to know more about the research, please contact Dan Jakes on 01242 539 935 or at dan.jakes@barnwoodtrust.org. Jakes is spelt Jacqueus. A note on terminology. The terms short breaks and respite care are used differently by children's and adult social care services. However, both are used to describe care services providing specialist care and support to families of disabled children and adults, so that unpaid carers receive breaks from their caring responsibilities to maintain their resilience and their physical and emotional well-being, and that disabled children, young people and adults have opportunities to socialise independently in an environment that is safe, secure and suitable for their needs. Whereas non-disabled children may be able to complete activities independently or spend time socialising with their friends, for many disabled people this is not possible without the correct environmental adjustments. Such adjustments might include somewhere with specialist facilities such as a hoist, a sensory room, or the provision of specially trained staff who understand the child's needs, behaviours and health conditions. This means that many parent carers of disabled children require specialist provision to get the breaks other parents might have. Such activities could also include many of the childcare activities accessed by non-disabled children, such as sports clubs, brownies, scouts and drama clubs, but with the additional support of a personal assistant, for example. Who we spoke to. As far as possible, the focus of the research was informed by people with experience of providing, accessing or supporting others to access short breaks and respite care in Gloucestershire. In addition, the research designed was informed by an extensive review of literature related to short breaks and respite care in the county. In total, the experiences of 98 parent carers, 29 disabled children and young people, and 12 participants from local short breaks and respite care providers were captured via surveys. The data gathered through these surveys was built upon through 4 interviews with parent carers, a focus group with 9 local providers, attended by 11 participants, and 2 focus groups with disabled young people. One of these focus groups took place at a local special school, and the other was with young school leavers aged between 20 and 25 years old. All the research with young people was co-designed with a young expert by lived experience. The same expert by lived experience co-facilitated the focus group with young school leavers. All the data was gathered in line with Barnwood Trust's Research Code of Practice. A copy of the Code of Practice is available in the research section of our website. What did we find out? The research findings indicate that parent carers and disabled children and young people in Gloucestershire were experiencing a range of barriers and challenges to accessing short breaks and respite care. The results of the survey were that 94% of parent carers told us they were not currently accessing all the short breaks they felt they needed. 93% of parent carers told us that they had experienced at least one barrier to accessing short breaks provision. 52% of disabled children and young people told us that they were not attending groups or activities after school or at the weekend. 49% of parent carers told us that they were not currently accessing any short breaks or respite care support. 49% of parent carers told us that a lack of information was a barrier to accessing short breaks. And 38% of disabled children and young people told us through the survey that they had never been asked about any aspect of support they were receiving or wanted to receive. Overall, the research captured 3 main barriers that were said to reduce opportunities to accessing short breaks and respite care. These were assessment, information provision, and the availability and suitability of short breaks and respite care. Assessment. In the survey, 43% of parent carers said that assessments of eligibility were a barrier to accessing short breaks and respite care. The process of being assessed for eligibility for commissioned short breaks and respite care services was predominantly mentioned as a barrier by parent carers. They described it as confusing, focused on safeguarding, and not taking account of the wider context in which families were living. Furthermore, several parent carers also spoke about their perceptions of the eligibility criteria for meeting the threshold for assessed needs that entitled them to access short breaks and respite care support. Many parent carers also perceived the criteria for eligibility to be applied inconsistently or in ways that were not fully transparent. And several parent carers also reflected their concerns about how assessments were conducted. This included sharing their fears that they or their parenting would be judged and whether or not the process would be worthwhile. One parent carer of a disabled young person told us, "Because my daughter has low mobility disability and is a happy child with no aggressive behaviours towards others, she did not meet the criteria. The fact that I, as a carer, am often suicidal and with chronic illness did nothing to get any respite." Information provision. All three participating groups commented on a lack of good quality information available on short breaks, exacerbated by difficulties communicating with the local authority. Several parent carers were unaware of what short breaks and respite care were, whether they had the right to access them or how to access them. For many of those who did know, trying to obtain the information they needed or understanding what they had been told was said to be a challenge that limited their access to these services. This includes feeling they had to chase the local authority for answers to questions, and that the information that was obtained was of poor quality and confusing. For some parent carers, information that is not easily accessible, proactively given, or comprehensible was considered to be an additional pull on their limited time and energy. Providers of short breaks and respite care services describe breakdowns in communication with the local authority. These cause delays and risk the organisation's viability. Challenges accessing information also caused uncertainty, and many relied on other providers to stay up to date with what was happening. Disabled children and young people spoke about the barriers of information and communication from a different perspective. Like parent carers and providers, this group reflected on the lack of information they received about what was available to them. However, many also reported how they had not had the opportunity to communicate their needs or preferences, especially to professionals and providers, as they were rarely or never asked. One of the disabled young people who took part in the focus group for school leavers said, when asked about their preferences, "I have no idea. Nobody's ever asked me that. I don't know what to say. I've never been asked that. What would I like to do? I'm so used to being at home. I almost sometimes feel too scared to go out. I haven't had many social opportunities in my life, really." Availability and suitability. The availability, accessibility and appropriateness of the short breaks offer for disabled children, young people and adults was a key theme amongst all three participating groups. Across all three participating groups, a range of factors were said to contribute to challenges in the availability, accessibility and appropriateness of the short breaks offer in Gloucestershire. Availability. All groups spoke about a shortage of services available for the level of demand in the county. 75% of surveyed providers said they had sometimes, often or always been unable to provide short breaks support to families due to high demand. The same proportion wanted to be able to provide more of the services they currently provide. Parent carers noted how an already challenging situation has been exacerbated by the COVID-19 pandemic and the enduring impacts of the restrictions that were imposed. Accessibility. Several factors or features were identified as being essential to the accessibility of short breaks and respite care activities. These were said to include the proximity of activities to where people lived, access to transport, how easy it was for those attending the activities to take part, and the availability of trained and suitably qualified staff. Appropriateness. There was a view amongst some parent carers, children and young people that there was little provision in the county that they considered appropriate for their children. 29% of parent carers said that the ability of providers to meet their child's needs was a barrier, while several spoke about a lack of provision for profoundly disabled children and young people. A parent carer of a disabled young person explained, "We don't benefit from any respite activity. We take turns taking him to special yoga. We can't engage in a lot of the after-school stuff that providers organise, because it's after school, and by the time we get there, it's going to be too late, or my son is a bit tired by the end of the school day. The boxing club was a Friday night after school, so we just about managed to get to Gloucester for that. So that was travelling to Gloucester on a Friday. You can imagine that journey. It took about an hour and 15 minutes to get there for a 45-minute boxing session." Parent carers told us that rarely did overcoming one barrier grant the family access to the short breaks and respite care provision they sought. Instead, as we show through a series of scenarios, overcoming one barrier was often said to lead to another, and often even those who accessed short breaks found they went back to the start of the process when their child reached transitional milestones. Scenario A. Assess needs. For a child's needs to be assessed, it first requires parent carers to have enough information and awareness to access the assessment process. As has already been said, many families were unaware that they may be entitled to these opportunities. Those who do enter the assessment process then go through a series of stages. This begins with the assessment itself, a process many parent carers highlighted as difficult, worrying and stressful. Parent carers then told us about challenges if the level of provision awarded was too little, of there being limited suitable provision to choose from, and often having to find a personal assistant that is suitably qualified to support their child. With this in place, parent carers told us that there were often challenges getting to provision that they had found, either because it was too far away, at difficult times of the day, or because of their own lack of transport. Scenario B. Complex needs. Where children have complex needs, the barriers were said to become more complex to overcome. For example, negotiations around what level of provision should be awarded may involve more agencies and teams, such as continuing healthcare. Consequently, parent carers describe the need to fight on multiple fronts. Also, the complexities of recruiting a personal assistant are exacerbated further, as is the need to ensure that the staff at activities have the necessary training to fully support these children's needs. For example, knowing how to support someone who uses oxygen or how to follow epilepsy protocols. Even if someone has the right training, the parent needs to feel confident that the organisation or personal assistant is sufficiently insured and can be trusted. And scenario C, no assessed needs. In addition, there are many children with special educational needs and disabilities who do not meet the threshold for assessed needs. Equally, there are many parent carers who would not choose to seek commissioned services, either because they are happy with the activities they are accessing privately, or because they do not trust or wish to go through an assessment that may not provide the outcomes they want. Nevertheless, these families may too experience barriers to accessing short breaks and respite care. Unlike in scenarios A and B, where the first challenges are at the assessment stage, for these families the cycle begins with the search for suitable provision. These children still have additional needs that require support, and so these families may still have to find a personal assistant with the right understanding of their child's needs, or must be able to trust the setting to look after their child in the way they need. Likewise, they still need to be able to have the means to access the provision, such as access to a vehicle or public transport. These families too may reach a time where their child's needs change, or their child is at an age where they can no longer access the same opportunities they once were. In these cases, some parents will return to search for alternative provision, but others may find that they need an assessment to access more specialist services. How do we build a service that works for all? Everyone who participated in the research was asked about what their ideal provision might look like. The responses to this question highlighted that whilst there was a great deal of shared experience in the barriers to accessing short breaks and respite care, what individuals told us they wanted points to the importance of individualised solutions. To this end, participants' responses have been summarised into 7 principles for quality short breaks and respite care provision. These principles are specialist and fully trained staff, accessible, meaningful activities, services that are available locally, choice and autonomy for parent carers and children, regular and reliable services, services being parent and child centred, and processes that are safe, trustworthy and transparent. These 7 principles, if adopted as the underpinning priorities for short breaks and respite care, have the potential to build a service that works better for everyone: the local authority, the providers, parent carers and disabled children and young people. What is Barnwood doing? The findings of this research are being used in 2 ways. Funding. The original aim of this research was to inform a round of themed funding with a brief to be co-designed with parent carers and disabled young people. This brief was completed in early 2023 and the call for applications launched in April 2023. Providers were encouraged to apply for up to £60,000 to participate in a year-long test and learn project in which innovative solutions to some of these challenges highlighted in the research could be piloted. The findings of these pilot projects will be evaluated and all learning shared with relevant stakeholders. More information about Barnwood's themed funding can be found on the Trust website at www.barnwoodtrust.org/funding. Convening and engagement. Recognising that many of the challenges highlighted in this research cannot be solved with funding alone, the Trust is also committed to engaging with stakeholders, including the local authority, to seek solutions to the significant challenges identified, including around assessment and access to information. In October 2022, an engagement event was held with parent carers, young people, providers, commissioners, and the now former Director of Children's Services. In May 2023, the conversation continued with the new Director of Children's Services and other colleagues within the local authority to talk about the research findings. Further conversations and collaboration are planned. If you would like to get in touch about the barriers to short breaks research, contact Dan Jakes, lead researcher, on 01242 539 935 or at dan.jakes@barnwoodtrust.org. Jakes is spelled Jacquees. Barnwood Trust would like to thank all the parent carers, young people, partners and stakeholders who took the time to share their expertise for this research and for their continued support as the work enters its next phase. This film contains a summary of the findings from the research. A full report and other accessible versions of this research are available on the research pages of the Trust website.